Welcome, folks. We're going to get started in just a minute here. Let a few more folks file in, and then we will get started. Look at that, Trinidad. Hello, David, and welcome. All right, I think we're about ready to get started. So let me welcome everyone else besides David from Trinidad. Welcome, everybody, and thanks for joining us this afternoon. I appreciate it. My name is Kevin McMenamin with Loss Prevention Magazine, and with me, as always, who is usually my partner in organized retail crime, but today he's my partner in mental health. And as you can see, my partner here, Jack Britton, is found a way to definitely relax his mind as he does the webinar today. Is that live from the beach, Jack, or what do you got going on?
In honor of Mental Health Awareness Month, I thought we'd try something a little bit more serene. So I thought we'd join you from the beach today. Well, welcome everyone. Good to see you.
Nice job, Jack. All right, beautiful. Well, thank you everybody for the time today. We appreciate it. We've got a couple of really great speakers for you, and we're really looking forward to today's session. We're going to explore some opportunities with mental health, psychological safety. Crespo is here from Chicago Police Department to talk about trauma-informed interviewing. We're going to introduce Aaron Young to you here in just a little bit. But before we get started, I want to thank our key sponsor here, who also happens to be our education sponsor, the Loss Prevention Foundation. So if you are loss prevention certified, LPC or LPQ, make sure you keep track of today's session because it does qualify for 3 CEU credits for today's session. So please make sure that you document that so you can put it into your profile as you continue to log your education credits for recertification. Also, there's that awesome QR code that we use to subscribe to the magazine. If you are not already a subscriber of Loss Prevention Magazine, please make sure you pull out your mobile device right now and grab that QR code. It is absolutely free to subscribe, and we can get you subscribed to both not only the online digital newsletter and digital magazine, but we can actually have the magazine shipped to your home for free as well. So please do use that QR code now, or we'll grab it at the end. And when I bring it back up, you can scan it and subscribe. For those that are on the call with us today that are from our retail partners or our law enforcement partners, just so that you're aware of it, there are scholarships available for our ORC training. I know a lot of folks join us not only for the safety sessions, but for our organized retail crime sessions as well. So if you're on, just a reminder, they are free. So please do reach out to me and I will make sure that I get you the information to get into the courses for free. We also now have a new prosecutor and district attorney training program that's being released. So if you've got folks that are in your group, if you're with the Organized Retail Crime Association, or that you work with, or you're working on some cases with, and they need some education when it comes to organized retail crime, if they're a prosecutor or district attorney, that's a course that we worked on with RELA, with the NDAA, with CLEAR, and with the Loss Prevention Foundation. So please do feel free to reach out and I will get you those scholarships because that is also free. Look at all the free stuff we're giving away today, Jack. Jeez. All right, next up is the Loss Prevention Hall Awards, Investigation of the Year, Investigator of the Year, Loss Prevention Team of the Year, the ORCA, Outstanding Industry Initiative. There's a lot of awards that are being given away, and all the finalists have been listed. So if you go to lphall.com, check out the finalists in each category and get your vote in today. Voting is only open until May 31st. So we're less than 10 days away from closing that down, and the winners will be announced at NRF Protect out in Long Beach, June 3rd through the 7th. So get your vote in today.
A lot of great candidates with that too, Kevin.
Yeah, we've got
That's
some
worth
really,
taking a
really
look
good submissions.
regardless.
Yeah, really good submissions, and I can tell you that the voting is very close on all of them this year. It's really awesome. The turnout just in the last few days on voting has been higher than it has been in the last 4 years. So the numbers are fantastic, but get those votes in, make sure that the ones that you were hoping to win, get your vote. All right, and with that, Jack, I'll let you introduce our first speaker.
All right, our first speaker today is Erin Young. She is the Director of Health, Equity, and Wellbeing with WTW. Erin, welcome. Can you tell us a little bit more about yourself before we get rolling?
Absolutely. Thanks, Jack. Thanks, Kevin, for having me. So my name is Erin Young. My hair's a little bit shorter than it was in that picture, but I'm one of the directors here at WTW, and we are a benefits brokerage and consulting firm. I work on the consulting side of the house, and I'm one of the leaders in our national mental health practice. And what qualifies me to do that in some ways, I'm a clinical social worker by training. So for the bulk of my career, I actually have not been in consulting. I've been doing some level of direct mental health practice in the communities across all levels of care, outpatient treatment to inpatient psychiatric. And I've spent time working on the managed care side of the house with health insurance programs. And I came over to WTW several years ago to help lead and support organizations across the country and from a global perspective to help, companies understand meaningfully the impact of mental health for their employees and how that also impacts the larger organization as a whole. So it's a little bit about me, and I live in the Boston area.
Which is not a bad place to live.
It's not. It's very.
I might be a little biased being from New Hampshire, but it is, and especially in the last couple of days, right? Our weather's been pretty amazing. So
it has been lovely. It has been lovely. So,
absolutely. Well, we appreciate the time for you to join us, Erin, and bringing your expertise to the table. We kind of stumble upon each other, or I really kind of stumbled upon you in a way that might have felt a little bit like cyber stalking, but finding a lot of the things that you've presentations you've done and things that you've written, articles you've written online, and found that just the content to be fascinating, and really appreciate in reaching out that you were able to support us today and to have this discussion around the opportunities that we see here with mental health in especially in this retail environment.
Yes, thank you. So I have a couple of slides to share. I'm going to go ahead and pull
Perfect.
those up if it's all right with the team here. So I wanted to talk just a little bit as we talk about the concepts of psychological safety and mental health, just to level set, to ensure that everybody here really knows what we're talking about from this perspective. What I find is that most organizations naturally are not staffed with clinicians or with mental health professionals, but they are direct recipients or interface directly with the mental health system or mental health needs of their employees. So as we go along here, I just want to start off with this slide, and it's pretty dense, but I'm going to talk through it. I think it's really important to talk about what these key terms are and how we define these terms in this space, because what I find is that many of these terms are oftentimes used interchangeably, but we don't really have a meaningful understanding of what they are. So you might hear terms like behavioral health care or behavioral health. And this is very much a clinical term that is used sort of in the medical field or oftentimes in the health insurance landscape. And behavioral health care is really this category that includes mental health services, but also substance use disorder services. And it's this term that is used by carriers to classify those clinical conditions. Now, that is a very technical term, but the more common term that we hear, and we're talking about May, which is Mental Health Awareness Month, is this concept of mental health. And this is critically important to understand because I think many times people use this inaccurately so, and they're really referring to mental illness, which is different. But mental health is something that that's part of everybody's life. So all the people that are listening, you, me, everyone has some component of mental health that is part of our overarching well-being. It is a state of mind that is focused on sort of behavioral adjustment. It's, being free from, feeling anxious or, maybe disabling symptoms that prevent us from being functional in our day-to-day lives. But really it's, inclusive of emotional, psychological, and social well-being. And many people across the US and across the globe use the term mental health because it's a little bit more approachable, and it's less stigmatizing. But then on the flip side, we have many advocates in the mental health space that want to talk about and bring awareness to this definition of mental illness or mental health disorders. And when we talk about mental illness, we're really talking about clinical mental health conditions. These are conditions that have symptoms associated with them and allow us to provide a diagnosis. So those are things like depression. Those are things like anxiety, schizophrenia, bipolar disorder. Those are mental illness diagnoses, and it is different from mental health. So when you are struggling, or if someone is struggling or has a mental illness, they do have mental health conditions. But people that just have general mental health challenges day to day might not have a diagnosable mental illness. And so while they can overlap in that Venn diagram, they are distinctly different. And the mental health system that we have, especially here in the United States, has a lot of challenges and struggles. And I think it's important to know even further what some of these statistics look like so you can understand why this is so important in our day-to-day life, but also from an organizational and employment perspective too. So these are some statistics, and they're pretty easy to read, but I want to go through them because I think that they're very important. The tagline here at the top is really as it is. It's much more, mental illness is much more common. It costs more than you think, and it begins a lot earlier. So the first stat here is that mental illness and substance use disorders are 1 out of 8 emergency department visits. And that's important because most of our emergency rooms in many areas of the country are not always equipped to handle mental health crises. It also speaks to the fact that we don't have enough prevention or, outpatient services or early intervention that are preventing people from escalating and utilizing those medical services. When that happens, we create log jams in the emergency departments and for healthcare for other, conditions that may need treatment. And it has significant downstream effects to the whole health system overall. The second stat here is that caregivers of adults with mental health or emotional health issues spend 32 hours a week providing unpaid care. So when we talk about adults, we're talking about partners, spouses, husbands, wives. We're also talking about adult dependent children up to the age of 26. It also could be other people in your life, such as sisters or brothers, elderly parents. This is all time that is not compensated and oftentimes is not available for like short-term disability, or people don't use disability or leave to take care of these individuals. These 32 hours a week represents things like driving people to appointments, filling medications, talking to insurance companies, dealing with prior authorizations, but it also could be seeking and trying to find care for those loved ones. And this is a challenge because that oftentimes can bleed over and cause stress and anxiety and a lack of presence, or what we call presenteeism, at places of employment, which has actual, like financial implications downstream for employers. This last here on the bottom left is that 32.1% of US adults also experience a substance use disorder in conjunction with mental illness. This is very common. So almost a third of individuals who are struggling with mental health issues oftentimes can't get the help that they need. And what they do is they self-medicate those symptoms. And so they're trying to figure out a way to feel better, to feel less anxious, to feel less depressed. So substance use disorders are very common when people are struggling with mental health, and they are oftentimes multipliers when it comes to cost of care downstream. 1 in 5 US adults experiences a mental illness each year, so that's 20% of the population. And the biggest challenge here is that of those individuals, a very significant percentage actually don't receive treatment every year. So as you can imagine, untreated mental health issues and mental illness can cause significant issues both on day-to-day living, an inability to manage, for oneself, and can also create other ripple effects throughout families or in society. 50% of all mental illness also begins by the age of 14 and 75% before the age of 24. So what we're saying here is that these symptoms and these mental health issues for some of our older populations have been around for a very long time. We haven't historically done a great job of intervening early and getting children screened and getting them the care that they need. And then as young adults come into, the workforce, they're coming in and they're having exacerbated mental health issues. And so we are seeing that significant long tail of mental illness that impacts so many different areas of society. And then I think one of the biggest and most alarming statistics is that the average delay of onset from experiencing a mental health or a mental illness condition is 11 years. And so what I like to say to people is that imagine if you had the same physical health condition, maybe you had and something that was indicative of cancer. Maybe it was a symptom that was indicative of heart disease or diabetes, and you waited 11 years to get treatment. If that had happened to a physical health condition, oftentimes what occurs is that the disease progresses. It may become untreatable in some regards, or very difficult to treat. In a worst case scenario, you might die. And that is the same for mental illness too. The longer that we go on and we don't treat mental illness, in some cases it can be harder to treat. It can be treatment resistant, or we have many people who are plagued by the symptoms and end up taking their own life and dying by suicide. These are preventable, but there's oftentimes many reasons for why we have these delays in our health system. So this slide here just shows you a little bit about the provider shortages that are common in the United States. As you can see, this map is very dense, but we're losing more mental health providers, both psychiatrists and mental health clinicians like myself, because career is very difficult. It's a high burnout field. It's long, irregular hours. Frankly, there's safety concerns when you're dealing with people who have serious mental health issues. Reimbursement rates are low, so it can be very hard to create a thriving career that is sustainable with the cost of living. We have many people that are retiring, and unfortunately, we just do not have as many programs or graduate programs such as like social work programs or counseling programs graduating individuals at the same rate of retirement. And we have significant geography challenges. So in our rural areas, so you can see, down in Texas, for example, we have far fewer providers than what the population actually needs. And so when you look at this map and you think about the mental health issues, and the prevalence that happens with mental health and the lack of providers that are available readily to see individuals at a early intervention or prevention level, you can see how mental health issues escalate very quickly and ultimately, create many of the issues in the workforce and across, multiple areas of our economy that we're seeing today. So that is just a little bit of a deep dive into some of those stats. It was very quick, but I would encourage anyone to peruse the Alliance on Mental Illness for additional statistics if they are interested.
That's it's a bit eye-opening, Erin. And the comparison between physical and mental illness that you used, as far as, you know, if you let a heart condition go, you know, if you go to the doctor and the doctor says, hey, you've got this symptom and this is going to need to be treated, you go and you get your treatment right away.
Yep.
You know, is there any change in that 11 years? Like, if you looked back even 5 years ago or 10 years ago, do you think that number's getting, like, was it 15 and 20 years before we do it, and now it's down to 11? Or do we not have that kind of comparison to be able to tell that? Like, are we getting better, you know, with all these types of programs that we're doing on mental health and getting people to be more aware of it?
Yeah, that's a great question. So some of this data is very difficult to analyze. So we're not able to analyze it, you know, year over year. We have some space between it. So I'm hoping that the next iteration of this data that comes out, it is proving to be a little bit better. But I can say that I think that we are doing some things right. So in the mental health space, especially over the past 10 years, we've seen just a general heightened attention to mental health. And that's by way of a couple of things. That's through benefits, so like the physical benefits and employee benefits that we offer to our individuals, but also to the organizational and the culture that companies are implementing, being more mental health friendly, you know, mental health aware. So when WTW has done a lot of research, and we do a ton of research with many of our clients, what we find is that when we evaluate the clinical conditions that are a priority, employers are, if they're not ranking mental health as the #1 clinical condition to address by way of benefits and programming, it's one of the top 3. It's also a very big cost driver. If you know, anyone out there is, you know, on the HR benefits team and you're looking at your, you know, carrier and your overall claim spend, it's got a significant portion of that spend. So ultimately, employers are realizing that this antiquated approach to mental health of the past is no longer suitable. And that was just sort of checking the box and ensuring that you had really the basics for care. So maybe you had some EAP support and your carrier, and that was it. Now employers are realizing that with the competitive drive for talent, culture is just as important as the benefits. And employers actually have a very direct role in how they can sort of support mental health at the employee level and start to make some impacts there.
If you look at the current trends out there, Erin, and you consider the fact that we've gotten so much more involved with the mental health aspect of this, how do you think that we got to that point? Where have we gotten better at recognizing the issue? And what do you think are some of the things that employers are doing right and what they're doing wrong? What can they do better, you know, when it comes to this issue in the stores and in the companies?
Yeah, so absolutely. I mean, there's a cost to doing nothing. And so it is never recommended to not put some level of emphasis on mental health. So thinking about that from the individual state, but also from the larger systems perspective is critical. Especially when you think about retail and some of the stratification that we have in those income bands. It's also really important to keep in mind the other levers or pressures on mental health. So those are things like social determinants of health. Those are, under income, underinsured, underhoused, food insecurity, all of those things, we need to start thinking about more holistically. So we are seeing, when employers start to look at the holistic, the whole person, approach, that's where we start to see things go right. When we silo everything out and we, we pretend that mental health is something separate from physical health and all the other aspects of well-being, that's where we see things to kind of fall apart and the wheels come off a little bit. So I think generally the trends are indicating that employers want to do more. They cannot do everything, but there are some, acute levers and very specific things that they can do to support mental health within their employee populations, both from a broad perspective, but also from, cohorts of population, from age bands, from, children, from clinical conditions. So the meaningful approach and thinking about that intentionally is where we see things being really successful.
Erin, what we see, especially in retail, is, the workplace is really become much more disruptive and volatile. What are you seeing that might be driving, some of these behaviors? I mean, the impact on the employees is, it's one thing to have your mental issues, even from things you have to deal with at home.
Mhm.
But then you go to work where you want to feel safe and you want to feel like you can just get your job done, and yet there's these other factors that are coming in.
Mhm.
What are your thoughts there on what we're seeing in this, especially in the increase of these behaviors?
Yeah, absolutely. So, we live in a more complex world than we did 10 or 20 years ago. The world that we live in now has different stressors than it did 10 or 20 years ago. Technology is very different. Generally, people are carrying with them, higher burdens of anxiety and stress. Workplaces are becoming, very performance, driven, and all of those things have an impact. And then when you think about what's going on in people's home lives, and whether that's, some of those things I mentioned, it could be, being underhoused or homeless, it could be a child with, very serious physical health or mental health conditions. People bring those really, into the workplace, and those mental health needs are becoming more complex themselves. So I think it's important to point out that the majority of people who live with a mental illness are not, violent or disruptive. But, many of the significantly traumatic events that have happened in workplaces do end up having a link to mental health or mental illness or other issues, therein. And so, as we think about the ability to cope with those stressors in a healthy way, the management of negative feelings or situations is this skill that really needs to be cultivated and practiced. More importantly, it also needs to be encouraged by managers, but also leadership within organizations, right? So it's great to have, a mental health strategy, but it's not great to have one in name only. So there really has to be that buy-in to that culture and those very specific supports in place for the people that are interfacing with employees, but also customers day to day, and how to cope and manage with those stressors.
So Erin, help me out here a little bit. What exactly is psychological safety, and why is it important?
So great question. So psychological safety is the belief that I or someone will not be punished or humiliated for speaking up with ideas or questions or concerns or mistakes. And so that there's no retaliation, that it's a safe environment. And it really refers to people's perception or belief that they can take these interpersonal risks in the workplace. So they can speak up, they can express their opinions or ideas, even if they are in, direct opposition to a leader or a coworker. That they can safely admit that they made a mistake, right? That there's not going to be a negative consequence related to that. And psychological safety nurtures an environment where people can then feel encouraged to share creative ideas, feel no judgment, not feel like they're stepping on people's toes. And it's important here because it can really set the tone for organizational culture and the employee support within a company. So when a company really leans into, psychological safety, it can build and allow for things like innovation. It can allow for growth. Failure is important. People don't love to talk about failure in general, but I think it's important for many organizations, to think about, how people can be comfortable in failure in an organization that can drive it forward. But it can also create just safer environments for everyone. And that includes things like speaking up against, and preventing abusive behaviors in the workplace. So things like bullying, any sort of microaggressions in that regard. And being able to speak up in that safety can ultimately prevent, and have some risk mitigation down the line too.
Yeah, I think there's a tremendous opportunity for, as you said, with growth, with innovation, if you could, sometimes it's the stupid questions that actually get you to the better answers, right?
Yes. Yes.
And it's important to say there are no stupid questions and have people really believe and understand that, because, you don't always just know the answer. And if you can't talk about it, then you don't get to the answer.
Right. Absolutely.
That's why I'm so good at this, Kevin. I ask a lot of questions.
We have a lot of folks, Erin, on the call that manage teams,
Yeah.
whether they're, loss prevention folks in the store that have teams, district managers, regional people, and directors, or even solution provider partners that have teams of folks that they work with. What are some of the considerations, even outside of like company benefit programs and things like that? But, what do you think would be top of mind in what you would recommend from the standpoint of, managing and like supporting team health?
Yeah, team dynamics are so interesting. And, it's like many organizations or teams, like, I like to say, when you've seen one team, you've seen one team, right? It's not a cookie cutter approach. So
I like that. That's really good.
what I'm saying, and what will follow here, I think needs to be, taken at a high level, but then, individuals out there who see and operate teams need to think about, does that fully apply? How would we modify that to our team? But I mean, each company also encourages and promotes different types of team dynamics, right? So I sit in a world that is not retail. So most of the stuff that I do is remote work. It's very different than, having to run and operate retail stores. But it's rare today in this world that people don't have to work on some kind of a team, or that they're, whether it's day-to-day interactions or just generally completing their work. So in my guidance with organizations, across the country, we found that there's basic awareness training on mental health is very important. So we train our employees to do many things, right? We train them to read reports. We train them to stock our shelves. We train them to make presentations. We train them to interpret data. We oftentimes do not train people on how to be managers. They end up in that role, but they are not given some of those skills or trained up. We just expect it's a skill they have by way of what they've demonstrated in a previous role. Many people struggle with this. I recommend to my clients that the implementation of basic mental health awareness training is beneficial, because it allows for some skills that might not be natural. So those are things like active listening and empathy, being able to hear and listen and see what's happening on team dynamics that might not be coming out or articulated, verbally out loud. Perhaps some of that training might be embedded in companies like learning and development culture, but I would also recommend specific manager trainings around working with teams and some of those very unique team dynamics. And you have to be careful, because I'm not suggesting or recommending by any means that we want team leaders to be therapists, to provide mental health care. But that active listening and that empathy can help them understand on what to listen for. But then managers, what we find frequently is that an organization might have all these lovely benefits, but they're only good if people know that they're there, or know how to get people where they need to go at the right time, and how to get them to the appropriate service at the right time. So managers need to be equipped with, whether it's tip sheets or resources on how to get people to the services they need, mental health being one of them. And it's important that in the retail space to be aware that some cases in that benefit ecosystem may not be available to all employees, as you think about seasonal temp, part-time workers. So it's also important to think about how you can leverage your benefit ecosystem, but also things like national or community resources that can be equitably available to everyone. So those are things like, the National Suicide Prevention helplines. NAMI is a great example. Things like, people who are in recovery, AA or resource groups like that. So those are a couple of things that we would, talk about in terms of that team dynamics component.
What about like self-care, and looking at it from that perspective? I mean, obviously, or just dealing with people who are just very close around us on a daily basis. What do you think some of the recommendations would be for that?
Yeah, so I think self-care is interesting. Self-care has a lot of just moving definitions on how people define it. But I think that it's really important that, people think about what self-care means for themselves. So that could be things like setting boundaries, saying no, not overextending yourself. Self-care can be taking time away from the workplace or engaging in activities that provide some level of mental, respite. It could be formal mental health services, frankly. It could be engaging in therapy or coaching. But also I think that what is really important is, engaging in resiliency practices, because those are the responses of how you respond to stress and workplace situations, and your ability to be resilient and rebound from those acute issues that happen in that moment.
Well, there's probably a level of vulnerability there too, right? That people have to be able to recognize and admit maybe that they need that help, or that there's that underlying condition, or that they need to, it's really easy to just be like, oh, I got to take some time off, or I got to get away. But,
Yeah.
how do we make ourselves do that? How do we make time for ourselves, right?
Yep. And I mean, that comes with, organizations need to support that. And there also is, still a lot of stigma around mental health. And so being able to destigmatize, the need for, it's okay to not be okay. It's okay to, get yourself the help that you need. No one would ever, criticize or stigmatize someone getting, chemotherapy, or, needing to go to the doctor for a broken arm. And so we should be treating, mental health in that same way.
I love the analogies there, because they're so easy to relate to, because you would go and get help if you needed it physically. So why would you not go and get help if you needed it mentally?
Yeah, absolutely.
So
All right.
with all the different problems that we're seeing in retail today, Erin, what are some of the signs that you think we should be looking for? And then do you have any recommendations that each of us can practice to best support those around us every day?
Absolutely. I mean, there's some technical things that people can look for. So you can always look at, and point to, hard numbers on things like your healthcare claims rising, short-term disability, and the reasons for taking short-term disability. You can look at things like turnover. You can look at, all kinds of different metrics in the workplace. Those are some objective ones, but also I think in general, like I said, the basic awareness and understanding of mental health in the workplace is really, really important. Understanding just like the basic sort of, signs and symptoms, and that's not, again, to create a bunch of clinicians or, pseudo clinicians running around out there, but, understanding when someone on your team or around you is just, a little bit off. And I say this, that one of the things I think is very interesting is that, we talk about depression, and depression, everyone's like, oh, you're sad, and like, you're going to be crying. But really, there's other indicators of depression. And so like in men, for example, one of the key symptoms is irritability and anger. And so being able to understand, and again, have some basic understanding of what some of those differing behaviors on your team members and mental health symptoms might look like. And there's best practices really that are out there. And so it's going to be knowing those resources, where to point people too when they're in need, making sure that the earlier we intervene and get people care, the better the outcomes are likely to be. Taking care of yourself, right? Individuals, so people that are in leadership roles, in benefits, especially that are caring for tens or hundreds of thousands of employees, can be really daunting and emotionally taxing. So, taking care of yourself, as we talked about with that self-care. And then finally, I would say it's just really important to remember that mental health is not separate from health. It's an integral part of physical health, overall physical health and well-being. And it's important that we treat it as such so people can feel balanced. It can be destigmatized. People can feel healthy. They can perform, well in all areas of their life. And that is, both personal and professional.
Well said. Well, and I think, to use your analogy, if you knew that you had a friend that was going to have a heart attack, you'd speak up and you'd say something, right?
Right.
So,
Of course. I'd hope so. I'd hope you would.
I hope so, right? Exactly.
Yes.
Exactly.
Yes,
Well,
absolutely.
I'm taking a few things away from the conversation today, Erin, and I appreciate the time for sure. And I love when you've seen one team, you've seen one team. That one I'm going to carry and use in a project I'm working on right now, actually, because it demonstrates this isn't a one size fits all. By any means, and neither is a medical diagnosis for an individual, right? We're all different. So, but like you said, it all has to be part and parcel of the same, because it's all about overall health, and mental and physical health need to be tied together, and we need to look at that strategy more closely, not only across the business landscape, but in our personal lives as well. So,
well, thank you, Jack and Kevin, for the opportunity, and I
Erin.
appreciate it. Thank you.
No, we really appreciate it. That was fantastic. We are going to take any of the Q&A that any folks might have and ask you to go ahead and put it in the Q&A for us. And we're going to get Erin has to run, so we're going to take any of your questions, and Jack and I will bring them back to Erin, and whatever she can answer. If you have some, we're happy to pass those along and then get them back to you as well. So please do put any Q&A for Erin into the Q&A, and we'll get you some answers and get them back to you. Next up, we have, let's see here. I don't think I have anything else on my deck today, so I think we're going to go right into meeting Abe. Jack, you want to introduce Abe, and I'll skip going to the slide deck?
Absolutely. Next up, we have Abe Crespo, who is a detective and instructor with the Chicago Police Department, the Investigative Development Group. Abe, welcome. Thank you for being with us today.
Thank you for having me. It's an honor and a pleasure to be here sharing with you today.
Can you tell us a little bit more about what you do before we get into your presentation?
Yeah, so a little background. I've been with the police department for just under 24 years. The first 15 years I was in patrol, and the last about 15, 16 years, the last 8 years I've been with the Bureau of Detectives. I worked as a violent crime detective for the better part of 7 years. And in the last year, I became an instructor with the Investigative Development Group. We are an arm of the Bureau of Detectives. And basically what we do is we train all new detectives, all newly promoted detectives. We go through a 6-week training program with them before they hit the streets. We also are mandated by the state of Illinois to teach 4 classes to the recruits here at the academy, including interrogation, interview, CSA, and just the fundamentals of investigation. And we also, we're very busy. And we also recertify current homicide detectives and CSA detectives. We do their recertifications, and we're about to start a new program where we deal with non-adult offenders, and it's like a new screening instrument for them. So yes, my office is quite busy, and we've reduced our numbers by about 75%. So, but yeah, it's pretty rewarding work. And then on top of that, I'm also an adjunct professor at one of the city colleges, Chicago, teaching criminal justice. So that's basically my background.
That's great. That's great.
Yeah.
Well, thank you for lending your expertise to us today, Abe. We really appreciate it, and we appreciate you being able to take your time out of the busy schedule with Chicago PD to help support us. So,
Sure thing.
I'll let you and take it away.
All right, you want to put up? I could put up my graphic if you like. So I'm gonna share my screen. All right. Okay, so can you see what we're putting up there, Kevin?
Yep,
We can
you
see
got
it.
it.
Yeah, is it up there?
Yep.
All right, so basically what we're going to be talking about today, and I talked to Kevin and Jack about this to some degree, we're going to talk about trauma-informed interview techniques. And I'd like to tell you guys that most of the time when we're talking about trauma-informed interview techniques, we're talking about techniques that we use with victims. There's been a very big push to work with specifically sexual assault victims in a trauma-informed and victim-centered manner. So we kind of can try to extract as much information as we can from these particular victims. However, as time has progressed, and we've seen that some of these trauma-informed techniques not only work with victims of crimes, right? We see that they work with offenders or suspects. They work with witnesses, and it's hard to qualify what trauma is because everybody is different. However, these techniques have proven to be fairly reliable. That along with kind of cognitive interview techniques, which many interviewers use to try to eliminate like false confessions, which is something that is really, really difficult to do. But this is some of what we learned and what we deliver. So, first we ask what the question is, what is trauma? And it's anything perceived to be a life-threatening event, right? By the victim, by a suspect, by a witness, as far as loss prevention is concerned, maybe someone internally in the organization, so on and so forth. And what we have to understand is during these events, right, the brain doesn't work the way it's supposed to, right? And therefore, how we remember certain aspects of an incident are affected simply because we suffer trauma. They can have an impact on their ability to report any event, any incident, so on and so forth. But moving forward, if you think about the root cause of trauma, and again, I want to make sure that everybody understands that when we talk about trauma, it could happen to anyone, right? Albeit, like we said, victims, witnesses, suspects, so on and so forth. But the root causes of trauma can be violence, physical, sexual assault, general upbringing in the home, abuse, childhood, poverty, and socioeconomic stressors, right? Which in many cases, especially when we're talking about retail organizations and theft, when there are people who are, they're basically they do what they do to survive, for example, right? But poverty is a root cause of trauma. Any threatening events, held hostage, any other exposure to trauma, natural disasters, so on and so forth. So, I mean, there's a lot of things that can cause trauma. And when you're dealing with someone who has suffered some type of trauma, it may be more difficult to extract information. So, we're going to talk real quickly about how the brain works. We talk about the amygdala, fight, flight, or freeze, prefrontal cortex, the thalamus, and obviously the hippocampus. What we know about the amygdala is it perceives a threat, triggers the release of adrenaline, cortisol, opioids, oxytocin, and all of these things are done without the body, without the subject, the person even knowing that it's happening. It's a natural reaction, and it's kind of like the body, the brain trying to take care of the body, right? It happens before the individual's aware. So they call the amygdala the brain's smoke detector. The prefrontal cortex is the brain's watchtower, right? It mediates emotions, it allows humans to build relationships, and it upsets the balance between the amygdala and the prefrontal cortex, right? So when somebody is suffering any kind of trauma at any time during their life, during that particular instance, rational thought is kind of suspended, right? So that's where instinct comes in, right? That sixth sense, so on and so forth. And also where we talk about fight, flight, or freeze. And in more recent cases, they talk about fawn as well. Some people who just kind of give up. They're not frozen, but they kind of give up because they want the incident to end as quickly as possible. Then we talk about the thalamus, which is the cook of the brain. It takes information coming into the brain from the senses, incorporates them into, a short memory. It causes a breakdown of the thalamus. The trauma causes a breakdown of the thalamus. And then the important thing about this slide is knowing that rather than stored as logical narratives, that, a person who suffers experience, their trauma is integrated as sensory and emotional fragments, right? So we talk about someone trying to remember something in a logical sequence, say logical 1, 2, 3, 4, 5. They may not be able to do it that, right? They may be able to remember a particular incident, 5, 2, 3, 4, then 1. And it doesn't mean that they don't remember, what you may be asking of them, or they may not remember the information you're asking of them. It just means that they may not remember it in a logical order, right? And as far as a law enforcement perspective is concerned, we liken every investigation to like a 100-piece puzzle, right? So there may be 100 different things that an investigator may have to do in order to complete a successful investigation, and we have to put those pieces together. And that can include, the information that we extract from a suspect or a subject that we're interviewing, being a victim, witness, etc. Sight, sound, sensations, all of those things we've learned also in the past is that they are very strong triggers of memory. I was talking to Kevin not long ago when we were talking about sight and sound, so on and so forth. When I smell, something that, smells like salt water, I'm immediately, transported to Florida. I have friends there and I travel there often. And the great part about being transported there is that usually when I'm in Florida, I'm on vacation and I'm not doing anything, right? So, those sensory fragments, the sight, sound, the smell, they could be really, really important triggers, specifically when you're trying to interview someone who's experienced trauma, because it may take them back to the place and time where those things happened. The hippocampus, the hard drive of the brain, it's the memory bank, part of the limbic system. It consolidates the short-term memory from the thalamus and turns it into long-term memory. It's responsible for the memory of locations, objects, people, so on and so forth, right? So what happens during trauma normally is that the amygdala is activated, the hormones are released, the prefrontal cortex is flooded, and now a victim operates on the impulse, right? You're operating not rational thought, you're operating on impulse. For example, if you hear, gunfire, right? Once you hear that gunfire, you're like, okay, we're not going to stick around to see what's happening here. We're going to take off running the other way, or we're going to seek cover, for example, right? So that's basically what happens. You work on instinct. And that's where, that's where we get fight, flight, or freeze, right? I mean, once the amygdala is activated and the prefrontal cortex, once they're not working congruently, that's when rational thought is suspended and we start reacting to things, right? And that's why in relation to law enforcement organizations, military organizations, and even some corporate organizations, that's why you train people. You train, and train some more, because you want the person to have a specific reaction to a specific external stimuli. A lot of times you can't prepare. I mean, someone who's not trained in something cannot prepare for something that's inevitable, right? For example, I love to eat, but I'm not a great cook, right? So if I'm cooking something and there's something burning on the stove, I wouldn't know how to, fix it so that it tastes better, so on and so forth. That would be the job of a chef. They train as a chef to want to do it. So, to do their thing. Like for police officers, right? We train extensively, for example, especially most recently and after Columbine and all those things, we train extensively on active shooters, right? So we have a basis, right? So that we have a specific reaction to that particular stimuli. The trauma's effect on human beings is extraordinary. I mean, the brain's emotional centers overwhelming the rational centers, they could present any emotion whatsoever. And it's been, I've seen it, in some cases where I've had, victims say of a violent crime, maybe they were shot or they had some other type of violence, perpetrated against them. And when I'm interviewing them, they're giggling, you know what I mean? They're laughing, like that would be an abnormal reaction to the pain of, say, being shot, but everybody's different. We're kind of all a bunch of snowflakes, right? So everybody's reaction is different, but the brain's emotional centers over in the rational centers. The memory of an event is stored as sensory fragments, and they may not be able to explain anything in a logical sequence. Input traumas on the right side of the brain. They may not be able to participate in an interview and or an investigation in a rational manner. It regulates, your sense of self in the world. People become, especially after people, have suffered trauma and they have PTSD. Obviously, there's a lot of after effects of that, and it may impair them. It may want to make them change, like maybe change a job, maybe change where they live, try to change their circumstances, so on and so forth. So that's a lot of times what happens. The effects of trauma on a person can often be misinterpreted as false reporting to investigators who are not trauma informed. And I think that most police organizations, law enforcement organizations now are really taking the advice of the mental health community, such as Aaron Young, so on and so forth. We're taking advice from them and ensuring that we know that everybody's different, and when you approach a person who may be subjected to a certain type of trauma, you may have to come at them differently, right? I mean, I think that one of the things that I try to do in my job, and what I try to deliver in regard to content, is I try to tell people to be non-judgmental, and to come at people from a place of humility, right? Show you're a little bit more humble, because I mean, honestly, when you're not necessarily interrogating someone, we're interviewing someone. I think the most effective interview is almost have a conversation, right? You kind of build a rapport, so on and so forth, and then that's when you can become most effective, right? Someone who suffers trauma cannot control the effects of trauma. They can't just get over it. I mean, it depends on the type of trauma they suffered. It depends on how long ago that trauma occurred. So there are a lot of extenuating circumstances in regard to trauma and how it affects a person. And you cannot make a judgment, right, about credibility when you're talking to a victim or witness or suspect, or maybe an internal employee. You can't make a judgment just based on their demeanor, right? For example, like I said, I had somebody who had just suffered a violent crime and he couldn't stop laughing, right? Which didn't seem normal at the time, but maybe that was his coping mechanism. Obviously, no matter what you do when it comes to trauma, the most important thing you could do is show someone that you're listening to them and that you believe what they have to say. And even if, I mean, there's a lot of, I know when it comes to retail now, and even law enforcement organizations, I mean, loss prevention and law enforcement work together arm in arm, for example. There's a lot of times where you could become, you start believing in the worst in people instead of giving people the benefit of that, right? So, but if you want to extract information from someone, despite who it is, if you communicate that you believe them, that goes a long way into getting that person hopefully to open up and maybe tell you their story, right? I believe you means it can be communicated verbally. It really can be communicated through attending behaviors. By attending behaviors, summarizing, so on and so forth, mirroring. We'll talk a little bit about that in a few minutes when we get to the interview portion of my presentation. But if you use attending behaviors, if you're talking to someone and you're paraphrasing what they're saying, then they actually know that you're listening, because you're repeating to them what they just told you, right? And if you're doing that, they may have a tendency to think that you believe them more so than if you wouldn't do something, right? You want them to be as participative as possible. And obviously, all of us want to act in a professional manner, to carry yourselves that way, because obviously you represent the organization, that you're working for, right? So, and that's really, really important. Understanding the effects of trauma. The first impression of an investigator can determine the level of cooperation between the person being interviewed and the interviewee. and it affects the overall outcome of any investigation, right? You know, if you know, they use the term leaving a bad taste in someone's mouth, so on and so forth. And if you're more judgmental, so on and so forth, if you're talking at people instead of talking to them, you know, people have a tendency, especially someone who suffered trauma, they have a tendency to kind of turn that switch off. And that can become very difficult, because then your investigation becomes more difficult or more cumbersome, you know. So you could cause as much harm as good as an investigator, right? So if you come from a humble, you know, humility and informed perspective, and you know, many times, especially in retail, if you have a suspect that, you know, you have caught, so on and so forth, and you know, videotape evidence is usually readily available. Hopefully it is. You know, videotape evidence is usually available. So there, you also have to understand that, you know, there is some trauma in trying not to get caught, right? I mean, that's a huge deal as well. So that's something to consider, to be cognizant of. It's important to, you know, to treat the subject with respect, sensitivity, but, you know, show respect to everybody, right? If you want to give it, you know, if you get respect, you got to give it. And like in regard to law enforcement, how, it's not just law enforcement, but how an interviewer or an interrogator, right, or someone, you know, who works for a particular job, how they approach the subject, you know what I mean, has a lot to do with how they're going to respond, right? I mean, again, like I said, if the interrogation can be confrontational, you want, instead of confrontation, you want more cooperation, because then you get more information, and ultimately that's what we need. We have to understand that disclosure is a process, right? You know, the impact of trauma is physical, psychological, and very emotional. Sometimes we have to focus on the subject's need for their welfare, or for their own well-being, because that may well be where they're coming from. You know what I mean? For example, in a loss prevention aspect, you know, if there's like retail theft or something like that, you know, they may only be doing those. It may not be for financial gain. It might be for survival, right? So it's impossible to make that determination, say, and you know, in a 5-minute interview or a 10-minute interview, but you know, you do the best you can, and focus on the subject's demeanor, right? You know, when you're interviewing somebody, it's their interview. You don't know. I mean, and you may have information that you don't want to divulge. We'll talk about that again a little bit later, but it's their interview, right? And if you get them to open up, you know, there's a lot of times that if you get them to open up, they can't wait to tell you what they have to say. So to be most effective, you want to do that. And you have to be prepared to hear whatever. I mean, because at that point, if you do have someone open up, they may tell you something that, you know, you may be uncomfortable with, right? And then we'll get into secondary and vicarious trauma a little bit later. Trauma stored in the brain differently. Again, it's sensory and emotional pieces. The disclosure may come from out of sequence blocks, not 1, 2, 3, 4, 5, but 5, 2, 3, 4, 1. And if you want to, specifically in the retail field, loss prevention, if you have, you know, great cooperation, say with your local law enforcement agency, and there's information that you're able to extract from your suspect, for example, or whether it's external or internal, that would be great information to share with the investigator, because, you know, once the investigator has that information, then they're not starting from square one, right? So that may be one, you guys may be able to break it down and give us one of those big pieces of the puzzle that we need for the overall investigation. Okay? It's important to build rapport. You know, when I teach this, specifically to the recruits here at the academy and even to the pre-service detectives, I tell them, you know, by a show of hands, if you're from Chicago, you would understand there's 2 baseball teams, right? North side is the Cubs and south side is the White Sox. And there is a history of bad blood, so to speak. So I inevitably, I asked the Cub fans to raise their hand. Then I asked the White Sox fans to raise their hand. And inevitably, there's always going to be some chatter between, you know, who's better and who's worse and so on and so forth, right? But I tell them that because I tell them, I said, you know, try to find that common denominator, right? You can build and use rapport with somebody by, you know, qualifying the, you know, saying to them, hey, you know, I know where you're coming from, man. You know, it's rough out there. You know, hey, things are expensive. And that kind of thing, right? And if they can see a little bit of them in a little bit of you and themselves, and maybe that will soften the blow of what is actually going to occur, specifically if it's going to be an arrest or something like that. Try to motivate the individual to talk. That's always a great thing. Keep them engaged. Like I said, sometimes, when you get them going, they will continue to talk and, give you more information that you even anticipated. Listen closely to what it said and how it said. I could say the same thing for the interview. Sometimes it's not the question you ask, but how you ask the question. And then always try to clarify street terms and slang, like in a report later on, or like in your incident report or something like that, because, that can be a regional thing, how people talk. Always use open-ended questions. You don't want to paint someone into a corner. And, I could say this in regard to like retail theft and stuff like that. I mean, many times the loss prevention officer has a leg up because they already know what's missing. And a lot of times, say you have the eye in the sky, you have a video, it's very easy for you to understand what was already taken, how it was taken, so on and so forth. So you're armed with information. And the only thing that you want to do is if you ask them questions about what happened, you want them to fill in the blanks because you pretty much know or you saw what happened. It says not to use a non-directive approach, show empathy, patience. It's difficult. I think that one of the things that's most difficult for law enforcement officers and loss prevention officers, and it's very difficult to show empathy for someone who is trying to deprive another person of their property, right, for financial gain, so on and so forth. But in some cases, like I said before, there may be instances where the person, and we're not talking about maybe somebody who's trying to sell something to get money for drugs, but in some cases it might be just for for a plate of food or something to that effect. So we have to be cognizant of that type of behavior. And like I said, use that conversation stuff. I mean, I can't quantify that enough, right? It's so much easier to talk to someone instead of, like I said, instead of talking at them when you're talking to them. You don't have that divide, right? I mean, if you're sitting eye to eye, most of the time when you see an interrogation, like in the media or on TV or in a movie, it's a guy sitting at a table and he's handcuffed, and there's another guy standing on top, and there's a light flashing in the person's eyes, and you try to make them as uncomfortable as possible, and it's very confrontational. More often than not, that confrontational style does not yield the necessary information. That's why a conversational style usually works a little bit better. Avoid specific questions. And that also includes if you know aspects about the investigation that you don't want to kind of tip off your hand. Yes or no questions are don't really work very well because again, you want to get them talking, you want to get them engaged so that they could tell their story. Leading questions sometimes again shows your hand. If you have information that you know about a particular aspect of the investigation, if you use a leading question, they may know what you know, or they may figure out what you know. And always, rapid fire questions are always bad, simply because when you ask a question, you want the person, the subject, to formulate a response. And that helps for two reasons. It gives them an opportunity to answer without, without the urgency that some people are looking for, right? Or uncomfortable with, I should say. But more importantly, I mean, if they're formulating a response, you as an interviewer, right? And you may be able to see what some of their rationalizations are. You know what I mean? In many cases, if it's like retail theft, you know what happened, right? And a lot of times you're just trying to figure out why. Employ active listening skills, be encouraging. Right? Nod, yes, see, I'll paraphrase, summarize, like I said before. If you paraphrase and repeat something that someone has told you, then they know you're listening. And that's a huge tool you can use. Use emotional labeling information and mirror, right? I mean, I can't tell you how many times I've seen successful interviewers. You have somebody being interviewed, they cross their hands, or they, whatever the interviewee is doing is mirrored by the interviewer, and it kind of, I don't know, maybe sets a different tone where everybody's a little bit less agitated or more comfortable for that. Another, avoid charges like, we know you're guilty. Hey, you're going to prison this is a felony arrest, right? Where, they know they're looking at maybe more jail time. When you do that, usually you shut people down. I mean, because, now it's like you're trying to interview them and extract information, and all they think about is impending doom. This is what's going to happen to me because of, the decision I just made, so on and so forth. Many times they don't think about the ramifications or what the castigation is going to be for what they did wrong. But when you start using terms, like guilty and so on and so forth, then, it kind of refreshes their memory that what they're doing is about, right? Listen for rationalizations. There's a lot of reasons for something, this might happen. We've had people, that, commit retail theft, specifically in the city of Chicago, which, can be sometimes frustrating, because they've changed the amount of money that would cause it to become a felony from misdemeanor, so on and so forth. The threshold is a lot higher. So, you see the same people doing the same thing over and over again. But, a lot of times, when you question these people, they're like, hey, I stole formula because I needed it for my child. Right? I mean, so they can quantify their own rationalization, their own justification. But if you think about it, if somebody rationalizes what they did wrong or justifies it, that is actually a leg up for the investigator, because now you have motive. Now you know why they did it, right? And motive is a big thing. If somebody does something wrong and they tell you why they did it wrong, and you're armed with that information, it makes a lot more sense. And in some cases, change the subject's perspective. Right? I mean, just tell them, hey, what would you do if you were in my shoes? You know what I mean? If you're sitting here and you're watching somebody, steal, thousands of dollars worth of merchandise or something like that, how would you, what would you do? Right? And sometimes changing their perspective makes them introspective and say, I understand where he's coming from. That might break down a barrier, right? Protect as much evidence, protect your evidence as much as possible. Specifically, if you have like video evidence or any physical evidence, just protect that as much as possible. Again, what happened. You're trying to figure out why, and you want them to fill in the details. Use assumptive questions and try to work collaboratively with the subject, because ultimately, again, if it's confrontational versus non-confrontational, that non-confrontational interview is probably going to yield more results. The interrogation is the subject's interview. I mean, there's no other way to quantify it, right? You're trying to get information from them, right? I'm sure that if it's a particular suspect or subject that is well known to the interviewer or to the loss prevention officer, to the LPO or whatever, you may have background information on this person already, right? So you're armed with that information, but it's their interview, right? So be prepared for the interview. Allow them to talk. Don't agree with everything they say. And like I said, hold back information and let them fill in the blanks, because ultimately, you want them. It's not so much about incriminating themselves, but it'll help you better understand exactly what happened and why. Right. So, one of the things that we'll also talk about today, and I know that Kevin was talking to Aaron about this in regard to secondary or vicarious trauma. Obviously, there's names for it: compassion fatigue, psychological impact of exposure to difficult, disturbing or images, overwhelming exhaustion. Huge. I mean, when it comes to law enforcement officers, and I think it's fairly prevalent in the loss prevention community, is a feeling of cynicism. Because the same things happen over and over and over again, and ultimately you think it's the same people doing things over and over and over again, and there's no accountability, right? I mean, it's a revolving door, right? So I know it happens in law enforcement a lot. You're arresting the same people over and over and over again, and at one point you're saying to yourself, why am I doing what I'm doing, right? I mean, I'm going to lock somebody up, and it's 5 hours later, they're gonna be back on the street doing the same thing they were doing when I locked them up the first time, right? In retail organizations, if someone is successful, right, in a theft or something like that, they're more apt to try it. It may not be the same store. It may be like if it's a chain of stores or something, they may go to another store and try to perfect what they did. But cynicism plays a big role in a lot of what leads us to secondary trauma. And also you feel as if you're not getting enough done and you're not getting the cooperation, maybe in loss prevention world with law enforcement with state's attorney's office and so on and so forth. You feel like you're ineffective, like what you're doing is not enough, right? And that can cause trauma, obviously, for investigators. It can cause trauma for even victims, suspect witnesses, whatever, right? So it's really important to remember that. So why it happens, you feel sometimes that you don't have any support. You continuous demands. There's mixed messages about how you're supposed to do your work, how you're supposed to do your job when, for example, I spoke of this not a few minutes ago, but in the city of Chicago County took, for example, the threshold for a felony arrest in retail theft went, I think, from $300 to $1,000. And you're thinking to yourself, I'm continuing to do what I do, but they keep on pushing the goalposts back, right? It's making it more difficult for me to do my job. So, that can cause, trauma, right? A lot of times, when we deal with, arrestees, specifically when it comes to theft and any other crime, really, we're dealing with people that have already suffered, right? And they have, horrible stories, right? And if they open up to you, and give you, say, an idea or a rationalization of why they did what they did, right? And it's a traumatic incident, or maybe it was an upbringing, or maybe it was, lack of maybe their socioeconomic status or whatever. I mean, once you hear that over and over and over again, that's a real easy way to suffer from vicarious trauma. And when you have exposure to this type of when you have exposure to these types of things at work, obviously secondary trauma is very high among law enforcement officers and doctors, nurses, ER, and people who work in any law enforcement related field, right? Because sometimes you're dealing with the worst segment of the population, right? And that can be difficult. So one of the things that Kevin was asking earlier, what are coping strategies? Take care of the mind. Be aware when you feel like you're suffering from that type of trauma. Find support. Keep maintain friends, maintain a long line of friends. And if you have to, what we do in law enforcement specifically is try to maintain friends that are outside of the law enforcement network, right? Other police officers, sheriffs, so on and so forth. You maintain friendships with, what we would call civilians, for example, right? Because if we're able to maintain friendships with them, then every conversation doesn't turn into, what your last 10 arrests, right? And that's another thing that can engage the mind in secondary trauma, right? Resting, shut your phone off. That's a big thing. Right prior to this webinar, for example, I told Kevin that I'm getting 2 straight days off, and I can't wait to get away. I'm getting away right after the webinar, and I'm really looking forward to it because it's my chance to kind of unplug and refresh those batteries. Have fun, maintain a good diet, exercise. Yoga, they say, is great for reducing vicarious trauma and secondary trauma. As a matter of fact, the Chicago Police Department is making a huge push towards introducing yoga for first responders. It's one of the training unit's biggest things now, right? So every officer goes through wellness training, and yoga is a big part of that, right? So I guess everybody's organization is different, right? So I think you would have to find that within your own organizations and see if there is any opportunities for you to do things like that. I can't quantify this enough. Sleep is huge. you know, I've been extremely busy the last, probably the last 2 months. I've been extremely busy. You know, I lost 3 colleagues. I'm working by myself with an administrative secretary. There's a lot of training that's going on, and you know, private sector stuff, and work at a school. But I've made it a habit, right? And I usually get along on 6.5, 7 hours sleeps a night. I can tell you this right now: if you get yourself into a habit, say for me, if I get 7 hours sleep, I wake up completely refreshed. But learn for yourself what your limitations are, because I know that if I sleep 5 hours, I'm just not as sharp, I'm not as quick, I'm not as fresh, right? So quality sleep is extremely important, right? Not only, you know, secondary vicarious trauma, but you know, every aspect of your life, right? You know, and how you complete your job and how you do your job, so on and so forth, how you interact with family members and friends, so on and so forth. And hobbies. If you could find a hobby where it could transport you to another place at another time, you know, for me, it's riding my motorcycle. My brother and I, and many others, but my brother and I, you know, he'll call me up and he'll be like, "Hey, Abe, are you ready for some wind therapy?" Right? And unfortunately, I live in Chicago, which is, you know, it's cold 6 months out of the year, 5 months out of the year. So I don't get to ride it as much as I'd like to. But in the summer, you know, I try to take full advantage of the weather, and I try to get out there, and it's a big thing for me. So hobbies that take your mind away from what you do at work and what you deal with and the people that you deal with is huge. I can't quantify that enough. So yeah, that's basically all I have for today. I just think we have to be cognizant of a lot of the things in regard to trauma-informed interviewing. Just remember, and I think this is the most important thing I can tell you is if you're, we have a tendency to be judgmental because we see somebody doing there's something they're not supposed to be doing, and it's our responsibility to make sure they get caught, so on and so forth. But if you approach everything and you're non-judgmental, enter every interview with a blank slate, right? And find out, not, I mean, you know what happened, just try to find out the reasons why it happened, right? And again, you know, that may open itself up to the opportunity where not only you get that rationalization or justification, it gives you the motive, right? And once you get the motive, it makes it a lot easier to do the, you know, to complete the rest of that investigation. So that's it.
Very good. Thank you, Abe.
No problem.
One of the questions that I had for you, actually something that I wanted to point out, I really like this point, and I think that it's important for a lot of the interviewers out there to hear. You know, we have a lot of folks that are on this that have gone through all different types of interview and interrogation training, but I really think that one of the things that separates people is the ability to be prepared to hear whatever might be said. That was a comment that you made early on.
Mhm.
Is that something you can just expand on for me just a little bit?
Yeah, and again, when I talked to you guys about the beginning of where a lot of my training comes from and what I do when I prepare any type of curriculum or I prepare any type of presentation, you know, I'm coming from a trauma-informed, victim-centered area when we talk about criminal sexual assault investigations. So a lot of times when you're dealing with people, not only criminal sexual assault, but when you're dealing with people that have suffered violent crimes specifically, you know, some of these crimes can be really, really graphic, right? We have a group with the Chicago Police Department called the Special Investigation Unit, and they usually deal with criminal sexual assault of children, so on and so forth. And some of the stories that you hear can be really, really taxing, right? And it's not only that, Jack. If you think about, you know, we've recently lost, you know, a couple of officers in the line of duty. One was going home, so on and so forth. About 3 or 4 years ago, we responded to an active shooter where we lost an officer. And when you go through something like that, right, where you know, there's a high likelihood of death, right? Like we said about trauma, it's a life-threatening event, right? When you think about stuff like that, what you go through or what somebody else goes through, when they try to explain it to you, you may not be prepared to hear what they have to say. And the only thing I mean, you know, there, if you're dealing with violent crime, sometimes these crimes have horrific details, right? Up to and including how the offender or what the offender did to the victim. If the victim is alive, for example, they're lucid and they're talking, or maybe they've recovered from surgery. Some of the things that we dealt with in regard to violent crime can be, you know, really, really difficult to hear. When we talk to witnesses, right? Maybe somebody was there, right? Was a witness, but wasn't a victim to the crime. And, you know, this is stuff that they carry with them. So then when you hear it, right, it's something that you're reminded of constantly, right? I mean, there have been cases that I've had in the department that I obviously rather not talk about, but that involve children. And you got to be prepared for it, because you don't know we don't know everybody's background, right? I mean, you know, a lot of times we have this cognitive dissonance, right? That if we lead, you know, a good life and we're doing well and, you know, we have a job and we, you know, have friends and so on and so forth, not everybody has that, right? And some of the people that we deal with, you know, may be suffering from these types of deficiencies, right? And when we hear what they have to say, if we're not prepared, sometimes, you know, it could ring that bell and you say to yourself, wow, that's pretty, you know, I wasn't expecting that, right? I mean, so, you know, the only thing I could say is you have to be prepared to hear whatever they have to say, right? And that's part of the non-judgmental thing, right?
And
I think
Dave, how
it's
do you
more,
redirect them on that when they when you feel like they're using it as an excuse, right? Because like a lot of people today, you know, will try to leverage some type of mental health condition, you know, and make it the excuse for why, you know, they can't speak to you or why they can't be involved or they wouldn't have been involved or so forth, right? So
Right.
for an example, I'll use a really good, interesting analogy, right? So TikTok, right? So I'm watching this police officer video on TikTok the other day, and this young woman is had stolen a package off of a neighbor's porch. She's got the merchandise in her house. When they asked her about, you know, whether or not she had the package, and she said, you know, no, you know, to the person who owned it, she said, no, I didn't take it. And she said that, you know, you can, she said, I'm going to call the police. And the woman said, well, you know, go ahead and call the police, but why don't you just call Victoria's Secret and talk to them instead? So right there, she's already knows where the package came from.
right, 100%.
Supposedly doesn't exist, right? So the police show up, and when they start questioning her, she goes right into, you know, oh, well, I have anxiety, and you don't understand, and, you know, my life is so difficult, and, you know, I have all these things. And, you know, I imagine you guys have got to hear that, you know, all day long. And,
All
you
day
know,
long.
as a retail investigator, you know, we certainly hear that in our, I haven't done them in a few years, but I know, you know, for sure that I've had my share of excuses and, you know, and all that type of stuff. But for the folks that are still honing some of those skills, what do you recommend, you know, they think about or they focus on when some of those things come into mind? That, you know, is it that I really don't know their story and I'm going to hear their story, right? Because you get a lot of stories when you do these interviews, right?
Oh, yeah.
But, you know, where do you separate that?
It's kind of, I mean, it's kind of difficult. It's almost it's like qualifying the argument between a confession and a false confession. It's very difficult to differentiate, right? But one of the things I think I try to do is I compartmentalize what I'm doing, and I separate it from the actual process. For example, if somebody's tried, you know, they give me the whole song and dance, and they, you know, they tell me that, you know, maybe it's mental illness, or, you know, maybe they don't have, you know, a formula to feed their child, or, you know, they haven't eaten in 3 or 4 days. When they start giving me those excuses, that's really not going to, I mean, once a person is in custody, right, you know, they're in custody. So the investigation will play out. And if any of that, it's not really going to change the outcome of the investigation. You understand what I'm saying? A lot of times, you know, they'll try to rationalize, like I said before, you know, now she's got mental illness, she's got anxiety. So now what she's trying to do is make excuses for her criminal behavior. in your case, the one you were just talking about, right? In many cases, it works against the suspect, because the fact is, knowing that she's giving you excuses means she knows what she did is wrong.
Right.
Right. So you have to look at it in that perspective, right? So now if you didn't do anything wrong, you wouldn't have to give up any excuses, right? So you take that into consideration. And that's great that you said, which I'm really glad you said that, because that goes back into my focusing on the actual person on that subject. Every investigation obviously is singular. They may be similar, but they're not the same. So when you focus on the subject and when you focus on a suspect, and how they act and what they're doing, it lends to a better investigation. And this is what I mean. In your case, for example, my thing would be, they would tell you what they told you about what was in the box. That information you would reveal to an investigator. When an investigator gets there and they take the case on in order to move it towards, charging and adjudication, they're already armed with the information that the offender knew that there was Victoria's Secrets in the box, in the package, right? And then they come to the investigator and they give them the whole song and dance about anxiety, so on and so forth. So you go from a person who knew exactly what they were taking to a person who's now making excuses. And if you add the two together, two and two doesn't equal four, right? So a lot of times a great example is allowing them to talk, because when they start telling you those things, those excuses, that's where you find their rationalization, their justification, and sometimes that even leads to the motive. Yeah, but I allow them to talk. A lot of times, there's an old saying, you give somebody a rope and they kind of hang themselves, and that's basically what we try to do. You know what I mean? Yeah.
Yeah. I think I'd use if you give a mouse a cookie, but
yeah,
themselves too, right?
Right. Right.
But no, I think you're spot on, right? You let them talk, you let them get that out, and then you find those rationalizations, because you can actually leverage all that talking that they're doing, not necessarily against them in a bad way, but certainly to help them, to kind of bring them full circle into what it is that they've done, and in making that admission.
Yeah,
so.
let's be clear. I advocate in listening to people, right, and listening to people rationalize why they've done what they've done. But no rationalization is going to lead me to believe that somebody should break the law, right? So once the law is broken and once that person is in custody, the investigation is going to play out. And what happens with the investigation is going to happen regardless of what this person has gone through or they tell you they're going through, so on and so forth. If after the case gets charged and it goes in front of a judge, they want to take, some kind of corrective action where they're saying, okay, you know what? And, we're going to divert this particular person from, going to jail, and we'll give them the opportunity to go to some kind of rehabilitation, so on and so forth. That would then fall on the justice system, right? It doesn't, we have a job to do as loss prevention officers in retail and any organization, internal theft, so on and so forth. And as law enforcement officers, our job is to catch people who are doing things they're not supposed to be doing, right? And once we remain focused on that, and we could compartmentalize that to make sure that we are just concentrating on those things, everything else that happens after that, which is really not in our control, is just, like I said, we can't control it. So it's something that we really don't have to.
Yeah. All right, well, I'm going to have to stop us there. If anybody has any other questions that you want to throw in the Q&A, we'll look to get those over to Abe. We've gone a few minutes over here. We thank everybody for hanging in with us. Abe, if you stop sharing your screen for a minute there.
Oh, yeah. I'm sorry. I should have done that.
Yeah, no worries at all. No worries at all. Let me just go back into here. All right. Abe's done. Drop the questions in the Q&A. We'll get them over to Abe and we'll get them out with the links for today's session. Before we go, I want to thank our sponsor and our education partner today, Loss Prevention Foundation. Make sure you keep track of today's session for your CEU credits. There's that QR code. Unfortunately, I won't leave it too long, but if you go to losspreventionmedia.com, please make sure you subscribe if you're not subscribed already. It is free. Delivery of the magazine to your house and free delivery of the digital outputs to your email box. If you are connected with ORC or anything related to ORC and need some education and training for law enforcement or for district attorneys, please do reach out to me and let me know, because I've got scholarships, plenty of scholarships available, and I'm happy to make those available to you. And I think last but not least, if you can go to lphall.com, work through the list of finalists and get your votes in before next Friday, I think it is when it closes. So we've had some great turnout on voting already, but let's spread the word. Some of your favorites may be listed there, and people that you might know. Abe, we've got a law enforcement partner of the year. We've got investigation of the year. We've got investigator of the year. There's a few categories there, and the orcas are on there as well. I think we got G-Rock, Metro Orca, New England Orca, and I'm sorry that I'm forgetting the other one. Oregon's Orca. So, to all your law enforcement friends and all the retailers out there, get your retail friends and get them out there to vote. That's closing down the end of next week. And outside of that, Jack, any final parting words?
Oh, everybody have a great holiday weekend, and we hope to see you at NRF Protect here in a couple of weeks.
Yep, Jack and I will both be there. Abe, thank you again so much. It was a ton of information in a short amount of time. This is going to be one of those things where I recommend people to, even if you listen to it once, go back and listen to it again on the recorded session, because you're going to get something out of it. It's like when you watch that movie and then you go, I didn't notice that last time. It's going to be one of those type of things, because man, you dumped a whole lot of information there. It was fantastic.
Yeah, I apologize for that.
No, it was good, man. It was great.
And I'm really thankful that you guys invited me. It was a pleasure sharing with you, and by all means, reach out and I'll help out again whenever you need me.
We appreciate that. Thank you so much.
Thank you, sir.
Take care, everybody, and we'll see you again next time. Thank you so much.
Thanks, everyone.